Have an aching back? I sure get one at times, and some of you no doubt have endured back surgery. Well, Tiger Woods has just undergone his. The Jupiter Island resident and golf superstar withdrew from the upcoming Masters tournament after having successful microdiscectomy surgery for a pinched nerve in his back. Dr. Brett Osborn, a neurosurgeon at St. Mary's Medical Center, thank you for being with us, sir. We appreciate it.
Pleasure.
Talk about this. Is this a common type of surgery? It's not just reserved for pro athletes.
Not at all. It's a very, very common type of surgery. There are hundreds of thousands of these types of procedures done every year.
You brought your prop. Show us what we're talking about, where it occurs, and what kind of surgery is done, how invasive or non-invasive.
Sure.
We'll hold that up and go in tight on your prop there.
Absolutely. The spinal nerves are covered by these bony structures here that we have to penetrate in a safe manner, access the spinal nerves, and excise the disc herniation.
So you pull it right out of there.
That's correct. If you cone down right here,
as we zoom in, right?
zoom all the way in here. Let's see if we can see it. There it is. There's a red structure right there, which is representative of a disc herniation. The disc fragment is pressing upon the nerve, actually having exited the disc space itself, the normal disc space, which you can sort of see from the side here.
Right, and that's that discomfort that he's feeling, that sensation you get in the lower back there.
That is correct. And as the disc degenerates, and as the outer fibers of the disc degenerate, some of the disc actually herniates into the spinal canal and actually into the nerve roots, which exit the spinal canal at every level.
Doctor, let me ask you a question. Is this, what kind of surgery? How involved is it? Is it non-invasive surgery? You go in with microsurgery to do this kind of work?
The majority
as the name implies?
That's correct. The majority of the neurosurgeons use microscopes to do this operation. It's done through a very, very small incision.
How long are you in there? How long would Tiger have probably been in there?
In an uncomplicated discectomy, 45 minutes to an hour.
Goes home after he's done?
Potentially, yes.
Recovery time for him or the non-pro athlete?
Very, very quick.
He could be back to golf how soon in your mind with proper rehab, and he'll have the best?
Correct. With proper rehab, which includes strength training, of course, to strengthen the muscles of the back that have been cut through during the procedure, or at least mobilized, moved over. Recovery, I would say, for him to get back to golf, 3 to 6 months.
Not uncommon, a lot of torque in his golf swing. The average person, though, hurts their back and ends up needing this because of what? Just the wear and tear? We all have stretching, pulling, picking things up?
That's exactly right. We don't exactly know the precise cause, but it's some sort of excessive stresses that are placed upon the discs.
Last and quickly, for people who say, gosh, is it something I can just treat at home or without surgery? Obviously, you want to have a good doctor, but where's sort of that dividing line where you know? I mean, Tiger could have gritted his teeth, or the non-pro athlete could have gritted their teeth and lived with this without surgery. When do you know to go for that?
That's correct. About 95% of patients that have disc herniations, even in the context of leg pain and back pain, will recover with conservative treatments. Anti-inflammatory medications, physical therapy, exercise. Those 5% that don't end up going for epidural injections. If that doesn't work,
this kind of surgery,
then you have surgery.
And if you're a pro athlete, you're going to do that to recover as best you can.
That's correct.
Doctor, thank you very much for being our guest. We appreciate the explanation and hope it helps you the next time you're talking to your doctor about that aching back, Kelly.